So good morning to all of you. Good morning. So good morning to all of you. Good morning. Good morning. So I'm Dr. Pradeep Pawar once again with high yield MCQs specially for you. Okay, so all set for the exams and a quick go through, a quick revision through the MCQs. Right, we'll start. See this first MCQ. Chalo. When seen from the right atrium, the interatrial septum shows a depression, the fossa ovalis. The floor of this fossa is represented by, come on, answer students. The floor of the fossa ovalis is represented by whom? You can answer. I'm looking at the screen. The floor of the fossa ovalis is represented by, yes, septum primum. Your answer is septum primum. Just have a look at the slide. Look at this slide now. Septum primum, the floor of the fossa is represented by septum primum. Now what have we done here? See, what have we opened? What is this chamber? A visual slide, so just have a look. Which chamber have we opened? We have opened the right atrium. Okay, we have opened the right atrium. Tell me students now, a line joining the SBC to IBC from outside. What do you call this line as? A line joining the SBC to IBC from outside is known as what? The sulcus terminalis. Sulcus terminalis. A line joining the SBC to IBC from outside is known as sulcus terminalis. But the same line from inside is known as what? Crista terminalis. The same line from inside is known as crista terminalis. And this crista terminalis will divide the right atrium into two parts. Now this is the rough part of the right atrium, and that's the smooth part of the right atrium. The rough part shows structure similar to teeth of a comb. What do you call this as? Answer. What is this known as? Structure similar to teeth of a comb. And this is what we call as musculae pectinati. This is musculae pectinati. So that's the rough part. The smooth part shows three openings. One is the opening of SBC, the opening of IVC, that's the opening of IVC, and that's the opening of coronary sinus. Okay, just remember all these things. He has some visual slides here. So that's the opening of SBC, that's the opening of IVC, and that's the opening of coronary sinus. Tell me students, this opening of IVC is guarded by a valve. यहाँ पे एक valve होता है. What is the name of this valve? You can answer this. The opening of IVC is guarded by a valve. It's protected by a valve. What is the name of this valve? Anyone? Answer. This is what we call as the Eustachian valve. Eustachian valve. And the opening of coronary sinus. This is the opening of coronary sinus. There's a valve here. What is this valve known as? The Thebetian valve. Thebetian valve. So this is the Eustachian valve. That's the Thebetian valve. So this is right atrium. Who's on that side? On that side, that's the left atrium. अब ये क्या देख रहा? What is this that you're looking at? The interatrial septum. Interatrial septum. There's a depression here. You can see this depression in the interatrial septum. This is what we call as the fossa ovalis. Fossa ovalis. So floor is formed by, and this fossa ovalis is represented by whom? Septum primum. Septum primum. And this elevation, this elevation, what is this elevation known as? Yes, you can answer this. This elevation is known as the limbus fossa ovalis. And this limbus fossa ovalis is represented by whom? The septum secundum. Septum secundum. So be clear about this. The floor of fossa ovalis is represented by septum primum, and the elevation above the septum primum is the limbus fossa ovalis, and that is represented by septum secundum. Septum secundum. Is this clear to all of you? Okay. Fine. Now tell me students, what is this triangle? I'll just show you one more thing. If this comes as a visual for you, what is this triangle known as? A triangle which is bounded by the tricuspid valve leaflet. One leaflet of the tricuspid valve. Second is the opening of coronary sinus. And this elevation is known as the tendon of Todaro. So ये triangle होता है. This is the tricuspid valve leaflet, the opening of coronary sinus and the tendon of Todaro. What do you call this triangle as? Yes, this is the triangle of Koch, K-O-C-H. And who lies in this triangle? Can anyone answer this? Who lies in this triangle? The AV node. AV node lies in this triangle, and that's the triangle of Koch. Yes, correct. And just one last thing here. Tell me, where does the SA node lie? If this comes as an option in the MCQ, the SA node lies at the junction of, answer this, SA node lies at the junction of SVC with the right atrium. Just remember this. The SA node lies at the junction of SVC with the right atrium. So these are all the possible things that you can get in this slide. Okay, fine. We go to the next MCQ. Here to all of you. Answer this. A motorcycle rider, yes, a motorcycle rider met with an accident. The surgeon diagnosed as a case of Erb's paralysis. Nerve roots involved in Erb's paralysis are a straightforward MCQ. Answer this. Answer is C5, C6. C5, C6. See, you'll always get a history like this. A person is riding a bike or a person meets with an accident and there is a separation of neck from the shoulder. Ye typical history hoga. There's a separation of neck from the shoulder. So where's the pressure coming upon? The upper trunk of the brachial plexus. Who's involved? Upper trunk. What is that paralysis known as? Erb's paralysis. Erb's paralysis. And which are the roots forming the upper trunk? C5, C6. C5, C6 forms the upper trunk. And students, if you can quickly tell me, this C5, C6 nerve roots are mainly present in which nerves? Mainly they are present in two nerves. One is the musculocutaneous and the other one is axillary. Musculocutaneous and axillary. वैसे ना the others also have the C5, C6, but main concentration is musculocutaneous and axillary. Fine. एक दूसरा type of MCQ. There's another type of MCQ. A person is falling down, or a construction worker is working on the site, construction site. He falls down, and as he is falling down, he gets an object. Like suppose he gets a tree he gets, and he holds the tree, and he is not falling down. Then he prevents the fall. Okay, and he gets a jerk here, sudden jerk hota hai yahan pe. Later he's fine. He doesn't fall down. When he comes down after some hours, he finds that he cannot, fine moments of this hands are lost. So what do you think is this? What do you think is this? So when a person is falling down, when a person holds something, a person gets a hyperabduction. Hyperabduction. इसे बोलते हैं hyperabduction injuries. Which trunk of the brachial plexus is involved in this case? The lower trunk of the brachial plexus. Lower trunk of the brachial plexus is involved here. Which roots are involved? C8 and T1 roots. C8, T1 roots are involved. Okay? And this C8 and T1 are mainly going to supply what? The intrinsic muscles of the hand, the small muscles of the hand. And when these small muscles of the hand are paralyzed, we get a claw hand. Clear? Which nerves have got it? The C8 and T1. The C8 and T1 roots are mainly present in median nerve and ulnar nerve. Median and ulnar nerve. And this C8 and T1 mainly supplies the small muscles of the hand. And this is what we see in Klumpke's paralysis. ठीक है, lower trunk. ये याद रखना. Hyperabduction injuries, Klumpke's paralysis, and separation of the neck from the shoulder, Erb's paralysis. Fine. Tell me this C8T1, where is this present? These C8T1 roots are present in which nerve or which cord? Can anyone answer this? C8 and T1 roots are present where? In which cord? In which nerve? Bolo students fast. C8T1. You have to know all these things, and these are very important. C8 and T1 is mainly present in the medial cord. Medial cord. C8 T1 is lower trunk. Yes, lower trunk. That's the lower trunk of the brachial plexus. It is present in medial cord. Medial cord. Okay, fine. C7, 8, T1. C7, 8, T1 is present in what? C7, C8 and T1. Very specific on this, you should know. C7, C8, T1. Roots are present in which nerves? Bolo students, whatever you know, you answer. I'm looking at the screen. You answer. C7, C8, T1. See, देखो एक मिनट C8 T1 is present in the medial cord. So जो भी branches on the medial cord के, all the branches of medial cord will have C8 and T1, which is this medial pectoral nerve, medial root of medial nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm. Okay, so this will have C8 and T1. This one last nerve left, ulnar nerve. And can anyone tell me what is the root value of ulnar nerve? Root value of ulnar nerve. Anyone? What is the root value of ulnar nerve? That's C7, 8 and T1. C7, 8, T1. That's the root value of ulnar nerve. C7, 8, T1. Ulnar nerve is a branch of which cord? Medial cord. But ulnar nerve का root value is C7, C8 and T1. ये जो C7 fibers है ना, they come from lateral cord. The C7 fibers come from lateral cord. Fine. And C5 to T1, who contains this C5 to T1? C5 to T1, all the roots are present in two nerves. One, it is present in median nerve, and it is also present in radial nerve. C5 to T1, present in median nerve and radial nerves. Clear to all of you? Okay, so just remember, ये सब roots वगैरह याद रखना, very important. You will always get at least one MCQ on the brachial plexus, the roots and all. So be very clear. Fine, then we'll proceed to the next MCQ then, students. Okay, answer this. The deep fascia of the thigh encloses the thigh. Okay, the deep fascia of the thigh encloses the thigh. All the following statement about this fascia are true except. Answer this. Can anyone answer this? All the following statements about this fascia are true except. You attempt, then I'll tell you. Attempt karo. Anyone? Come on, students. Yes, very good, very good. Yes, it receives the insertion of gluteus medius. That's wrong. See, what is the deep fascia of the thigh known as? The deep fascia of the thigh is also known as fascia lata. This is correct. The deep fascia of the thigh encloses the thigh. It encloses the thigh. It surrounds the thigh. It is also known as the fascia lata. And this fascia lata on the lateral side, except are true except. Mohsin, all the following are true except, na? So except. So the deep fascia of the thigh is also known as fascia lata. Correct. This fascia lata on the lateral side split. Yes, split hota hai. It encloses a tract on the lateral aspect of the thigh. What is this tract known as, students? The deep fascia of the thigh on the lateral side, it splits and encloses a tract here. What is that tract known as? The iliotibial tract. Iliotibial tract. Okay. So the deep fascia of the thigh encloses the iliotibial tract, and into this iliotibial tract you get the insertion of two muscles. बोल सकते हैं कोई? Can anyone answer this? Insertions of two muscles into the iliotibial tract. One. This you should know. One is, what are these two muscles inserted? One is the tensor fascia lata, and the second one is the gluteus maximus. Clear? So gluteus maximus and the tensor fascia lata. These are the two muscles inserted into the iliotibial tract. Perfect. So laterally it forms the iliotibial tract. Correct. Receives the insertion of gluteus medius is wrong. Receives the insertion of gluteus maximus and the tensor fascia lata. Fine. Okay. Right. Right. Inserted on the lateral condyle of tibia. That's also correct. So this iliotibial tract is present on the lateral aspect of the thigh, and this iliotibial tract goes down and gets inserted on the lateral condyle of tibia. Is this clear to all of you? It is inserted on the lateral condyle of tibia. That's correct. Can anyone tell me the action of iliotibial tract on the knee joint? Action of iliotibial tract on the knee joint. Anyone? Answer this. What is the action of iliotibial tract on the knee joint? Come on, come on, come on, students, come on. Guess, try. Action of iliotibial tract on the knee joint, it does extension. Extension at the knee joint. Okay, it does extension at the knee joint. And what is the action on the hip joint? It does abduction and flexion at the hip joint. Abduction and flexion at the hip joint. This should be perfect. Huh? This you have to know. कोई doubt है तो बोलो. If you have any doubt in this MCQ, you tell me. Clear? So deep fascia, once again I'll repeat for you, the deep fascia of the thigh is known as the fascia lata. The deep fascia encloses the thigh, it surrounds the thigh. On the lateral side, this deep fascia splits, encloses the tract here. That's the iliotibial tract. That's the iliotibial tract. This iliotibial tract receives the insertion of two muscles, the gluteus maximus and the tensor fascia lata. This iliotibial tract is inserted on the lateral condyle of tibia. What is the action of this iliotibial tract? It does extension at the knee joint. And what does it do to the hip joint? Abduction and flexion at the hip joint. That's the complete thing about iliotibial tract. Okay, that's fine. Just have a look at this MCQ. I'll put a pointer for you. You can identify this. Chalo, I'll start. Identify this. One moment, I'll put a highlighter for you. Identify this structure. This structure. Chalo, start. Identify this. Some visuals I have put also for you. What is this structure? Can anyone answer this? Come on, students. This is extremely important. This is a, very important visual for you. What is this structure? Come on, students. Yes, very good. That's a spinal accessory nerve. Very good. That's a spinal accessory nerve. And this spinal accessory nerve lies on which muscle? Ye kya muscle hai? I'm putting a star for you. What is that muscle? Spinal accessory hai wo. This should be there in your mind. Spinal accessory nerve. And what is the muscle on which the spinal accessory nerve lies? Anyone? The spinal accessory nerve lies on which muscle? Bolo, students. You can guess. Even if it is wrong, it's okay. You can guess. So when you make a mistake, you'll always remember this. Trapezius nahi. Ye trapezius hai. This is trapezius. And what is cut here? That's the sternocleidomastoid. Ye sternocleidomastoid. No. Ye sternocleidomastoid hai. Aise. This was the sternocleidomastoid. On which muscle does the spinal accessory nerve lie? Here, this one. Ye muscle ka naam kya hai? This is the levator scapulae. Just remember this. Levator scapulae. It's not sternocleidomastoid, it's levator scapulae. So the spinal accessory nerve lies on levator scapulae. Fine, clear to all of you? Tell me, what is this nerve? Ye kaun hoga? What is this nerve? What is that nerve? Anyone? Don't read anything, don't read anything. This is the, yes, don't retract your messages. That's okay. Even if you make it wrong, it's okay. This is the vagus nerve. Vagus nerve, and there'll be a sheath here. Aise ek sheath hoga na, into which all these three structures are enclosed. What is that sheath known as? Ye sheath kya hoga? Carotid sheath. Carotid sheath. And students, if you can quickly tell me, there's someone who's lying on the carotid sheath like this in the form of a U-shaped structure who lies on the carotid sheath. Can anyone tell me this? What is this U-shaped structure who lies on the carotid sheath, anterior wall of carotid sheath? Yes, the U-shaped structure is ansa cervicalis. On the carotid sheath, the U-shaped structure which lies is ansa cervicalis. Yes, अब याद रखना, these are very important things which can be asked. What is this bunch of nerves? ये कौन है? What is this bunch of nerves? This group of nerves that you're seeing, what are those? This is the brachial plexus. Brachial plexus, huh? This is the brachial plexus, and brachial plexus के साथ एक artery होगा. What is this artery going to be? The subclavian artery. Subclavian artery. So the brachial plexus and subclavian artery, they go together. अगर ये brachial plexus है, ये subclavian artery है. Tell me students, what is this muscle going to be? I put a star on this muscle. ये कौन है? What is this muscle? This you should know students. Come on, answer this. Contents of carotid sheath, I'll tell you. One moment. What is this muscle which lies in front of the brachial plexus? What is that muscle? Yes, anyone? Scalenus anterior. Very good. This muscle is the scalenus anterior. Scalenus anterior. Sternocleidomastoid cut ki humne. This is the scalenus anterior. Remember all this, huh? Ye scalenus anterior hai. And if you can tell me what is this nerve lying on the scalenus anterior? Scalenus anterior. What is this nerve lying on the scalenus anterior? This is the nerve which goes to supply the diaphragm. That's the phrenic nerve. Phrenic nerve. Just remember all these golden points. These are high yield points for you. The nerve lying on the scalenus anterior is phrenic nerve. Phrenic nerve. Correct? Okay. So if you can quickly tell me what are the contents of carotid sheath. कोई बोल सकता है contents of carotid sheath? One, vagus nerve. Vagus nerve is already there through and through. Second is the internal jugular vein. Correct? Internal jugular vein. And third is the common carotid and internal carotid artery. Common and internal carotid artery. The external carotid will pierce the sheath and get out. It will pierce the sheath and get out. So common and internal carotid artery. Is this clear? Contents of carotid sheath clear hai? Who was asking me? Yes, Ashish? Clear? So vagus nerve, internal jugular vein, common and internal carotid artery. That is the content of carotid sheath. Who lies on the anterior wall of carotid sheath? That's the ansa cervicalis. Ansa cervicalis. Okay, is this clear to all of you? Tell me students, what is this? Ye kya nerve hai? What is this nerve that you're looking at? What is that nerve that you're looking at? This one. Can anyone answer this? Sympathetic chain is behind the carotid sheath. Yes, sympathetic chain is behind the carotid sheath. Okay, it was written lingual. That's fine. You've seen that. That's the lingual artery. Ye hypoglossal nerve hai. This is the hypoglossal nerve. That's the hypoglossal nerve. No, that's the hypoglossal nerve. Huh? Hypoglossal nerve. Remember that. This nerve which you're seeing is the hypoglossal nerve. You can see this. I am not modifying. I am not magnifying this. The nerve is hypoglossal nerve, students. And if you can tell me, ye dekh lo. I've magnified this. What is this? Ye bol sakta hai koi? What is this muscle and what is this muscle? Can anyone tell me what is this muscle? Another very important MCQ hai. Iske do heads aap dekh rahe ho. You can see the two heads. So what is this muscle and what is this muscle? Can anyone answer this? Come on students. This is the posterior belly of digastric. Posterior belly of digastric, and that's the anterior belly of digastric. Clear? So that's the posterior belly of digastric. That's the anterior belly of digastric. And what is this muscle? This one. This is the stylohyoid. Stylohyoid. So that's the posterior belly of digastric. That's the anterior belly of digastric. Pterygoids are deep. Pterygoids deep होते हैं students. Posterior belly, anterior belly of digastric, and that's the stylohyoid. Stylohyoid muscle. Okay, very good, very good, very good. Can anyone tell me what is the nerve supply of the posterior belly of digastric? Anyone? Posterior belly of digastric, nerve supply. Nerve supply of posterior belly of digastric and the stylohyoid together. Both has different nerve supply. No, I'm asking you nerve supply of posterior belly of digastric and stylohyoid. दोनों का nerve supply same है. Yeah, this too. That's the facial nerve. And what is the nerve supply of the anterior belly of digastric? That's the mandibular nerve. ये होगा facial artery, that's the facial artery, and what is this muscle in which the facial artery runs in front of this muscle? ये है masseter, that's the masseter muscle. Okay, so that's the masseter muscle. Clear? ये masseter muscle है, that's the facial artery, that's the posterior, that's the anterior belly of digastric, and that's the stylohyoid. I hope this is clear to all of you. Okay, we'll then proceed to the next MCQ. Right, answer this. Yes, very good. The following arteries are branches of celiac trunk except. Anyone? Following arteries are branches of celiac trunk except. Come on, students. Blood vessels, you should know. Huh? Blood vessels. Yes, inferior pancreaticoduodenal, except inferior pancreaticoduodenal. Inferior pancreaticoduodenal is the first branch of. Inferior pancreaticoduodenal is the first branch of. Answer this. Answer is A. Inferior pancreaticoduodenal is the first branch of superior mesenteric artery. It's the first branch of superior mesenteric artery. Inferior pancreaticoduodenal. Now, which is the branch of celiac trunk? The superior pancreaticoduodenal. That's a branch of celiac trunk. एक बार quickly, just orally, I'll tell you this. The branches of celiac trunk. Look here. So celiac trunk gives three main branches. One is the left gastric, second is the splenic, and the third one is the common hepatic. Left gastric, splenic, common hepatic. The splenic के branches क्या होंगे? One pancreatic branches, second short gastric branches, and third the left gastroepiploic artery. ठीक है? Splenic artery के branches, pancreatic branches, short gastric branches, and the left gastroepiploic artery. What are the branches of common hepatic? The common hepatic gives three branches. One, the right gastric, second, the gastroduodenal, and third is the hepatic artery proper. Hepatic artery proper. So common hepatic gives three branches. One is the right gastric, second is the gastroduodenal, and third is the hepatic artery proper. The gastroduodenal gives further two branches. One is the superior pancreaticoduodenal, and the other one is the right gastroepiploic. Superior pancreaticoduodenal and the right gastroepiploic artery. Clear to all of you? So this is about the celiac trunk. This you must be knowing. Chalo, I'll just proceed to the next MCQ. Answer this. Come on, students, answer this. The anterior boundary of the middle cranial fossa is formed by the superior orbital fissure. All the following structures pass through it except. Answer this. Anyone? Yes? Answer you can guess, students, guess karo na. Except, yes, the zygomatic nerve. Very good, that's the zygomatic nerve. So you know the superior orbital fissure, uske division sab pata hai na aapko. This you must be knowing. So the superior orbital fissure. Okay, this is not working. Quickly you tell me this. Quickly you tell me this. I'm not going into much details, but you can quickly answer this. That's a superior orbital fissure, and superior orbital fissure is divided by the common tendinous ring into three compartments. This is known as the ring of Zinn, and this ring of Zinn gives origin to the extraocular muscles, the rectus basically, superior, inferior, medial and lateral rectus. Okay? So that's the ring of Zinn. Tell me, the superior oblique muscle arises from where? It arises from the sphenoid bone, and the inferior oblique muscle arises from the maxilla. Remember this, inferior oblique muscle arises from maxilla. So tell me, what passes to the lateral compartment? The lacrimal, the frontal, the trochlear nerves. LFT, lacrimal, frontal, trochlear. Through the intermediate compartment are the two rami of oculomotor. Between the oculomotor is nasociliary, and this is the abducens nerve. And there's a inferior ophthalmic vein here, and there's a superior ophthalmic vein here. Superior and inferior ophthalmic veins. Clear? So that's the ring of Zinn, and this ring of Zinn will give origin to the rectus. Once again, I'm asking you, where does the inferior oblique muscle arise from? Yes, very good. Inferior oblique muscle arises from. Inferior oblique muscle arises from. Boliye students, come on, answer this. Inferior oblique muscle arises from the maxilla. Remember, inferior oblique muscle arises from the maxilla, and the superior oblique muscle arises from the sphenoid bone. Sphenoid bone. Okay? Yes. All the extraocular muscles are supplied by third nerve, oculomotor nerve, except LR lateralatus, which is supplied by sixth nerve, and the superior oblique, which is supplied by fourth nerves. Lateralatus and superior oblique. Clear? So all the extraocular muscles are supplied by sixth nerve, except the lateralatus by sixth and superior oblique by the fourth nerve. Fine. Okay, students. You know the superior ophthalmic vein, it drains into what? कोई बोल सकता है ये superior ophthalmic vein is a tributary of what? Come on students, if you can answer this. Superior ophthalmic vein drains into. Yes. Superior ophthalmic vein is a tributary of. Bolo. Come on students, this is important. The superior, cavernous sinus. Very good, Wasim. Very good. So the superior ophthalmic vein is a tributary of cavernous sinus. Yes. And this superior ophthalmic vein carries the infection from the dangerous area of face to the cavernous sinus. It carries infection from the dangerous area of face to the cavernous sinus. That's the superior ophthalmic vein. Okay, that's fine. That's it. एक और चीज बोलो. Yes. Just one more thing. Where is the nucleus of trochlear nerve located? कोई बोल सकता है? Where is the nucleus of trochlear nerve located? चलो बोलो बहुत बच्चों. The nucleus of trochlear nerve. In which part of the brainstem is it located? Which part of the brainstem? So the nucleus of trochlear nerve is located in the midbrain at the level of inferior colliculus. Inferior colliculus. Yes. Both ways, Wasim. Yes. So the trochlear nucleus is located in the midbrain at the level of superior colliculus. At the level of inferior colliculus. Inferior colliculus. Superior colliculus पे कौन आता है? Oculomotor nucleus. Okay, the nucleus of oculomotor nerve is at the level of superior colliculus. Okay, students, if you can quickly answer this foramens. एक मिनट, if you can quickly answer this foramens. चलो बोलिए. I'll start with this. Start. What is this? Whatever you can answer, you answer. Just, yes, it decussates. Very good, Vasim. Very good. Answer this. What is this foramen? Students, come on. A rapid fire for you. What is this foramen? A quick last minute revision just before the exams. Come on, students. Answer, all of you. Sab log answer karo. Even if it is wrong, it's okay. Understanding. That's okay. No problem. We are here to correct. Start. What is this foramen? Bolo, jo aata hai wo bolo na bachcho. Come on, be fast. This is the optic canal. Optic canal. Optic canal बोलते हैं. Very good. Optic canal. What is this fissure? ये क्या fissure है? That's the superior orbital fissure. That's the superior orbital fissure. Yes. What is this foramen? ये क्या foramen होगा? That was superior orbital fissure. What is this foramen? Anyone? Very good. What is this foramen? Come on, students. Come on. Exams are close. What is this foramen? This is the foramen rotentum. You have foramen rotentum. And what passes through the foramen rotentum? Anyone? No, ये foramen rotentum है. What passes through the foramen rotentum? Maxillary nerve. Very good. Foramen rotentum and maxillary nerve. Very good. ठीक है. What is this foramen? Foramen rotentum के पीछे होता है ये. That's foramen ovale. And what passes to the foramen ovale? Yes, what passes to foramen ovale? MALE. ये आपको पता है. The mandibular nerve, the accessory meningeal artery, the lesser petrosal nerve, and the emissary vein. MALE. You know this. What is this foramen? ये कौन है? What's this foramen? Foramen ovale के पीछे, behind the foramen ovale, there's a very small foramen, and that's the foramen spinosum. Foramen spinosum. And what comes in through the foramen spinosum, what enters through the foramen spinosum is nervous spinosus and the middle meningeal vessels. Nervous spinosus and the middle meningeal artery, you can say middle meningeal artery. And what is this big foramen here? That's the foramen lacerum. Very good. That's the foramen lacerum. And who enters the skull through the foramen lacerum? If anyone can answer this. Who enters the skull through the foramen lacerum? That's the internal carotid artery and the deep petrosal nerve. Internal carotid artery and the deep petrosal nerve. Okay, fine. Right. So what is this bone? ये क्या bone होगा? That's the greater wing of sphenoid. Correct? That's the greater wing of sphenoid. Tell me, students. That's the petrous part of temporal bone. What is this foramen? A quick go through it. A quick go through it. What is this foramen? अब यहाँ से अगर हम जाते हैं, we go in through this. We are right inside the internal here. So that's the internal acoustic meatus. Internal acoustic meatus. What passes? 7th nerve, 8th nerve and labyrinthine artery. Clear? 7th nerve, 8th nerve and labyrinthine artery. What is this big foramen? Jugular foramen. That's the jugular foramen. उसके 3 compartments होता है. Just go through it. And that's the foramen magnum. And यहाँ पे होता है ये hypoglossal canal. On both the sides is the hypoglossal canal. Right? So that's about the skull. Chalo, we'll go to the next MCQ, students. Come on, students. Boost up yourself. A 18-year-old patient complains of pain in the abdomen. On USG, polycystic disease of the ovary was diagnosed. Lymphatic drainage of ovary is through which of the following lymph nodes? Yes, can anyone answer this? Can anyone answer this? Yes, very good. That's the para-aortic lymph nodes. Remember, students, the testis and the ovaries drains into which lymph nodes? The para-aortic lymph nodes. Para-aortic, okay? Testis and the ovary, they drain into the para-aortic lymph nodes. Can anyone tell me what is the blood supply of the testis and the ovary? The testis and ovary are supplied by gonadal artery. Gonadal artery, and this gonadal artery is a branch of abdominal aorta. Abdominal aorta. Gonadal artery, that's a branch of abdominal aorta. Clear to all of you? The deep inguinal lymph node specifically drains what? Specifically, the deep inguinal group of lymph nodes, they drain the superficial inguinal lymph nodes. Yes, one, they drain the superficial inguinal lymph nodes. The deep inguinal lymph nodes also drains the glans penis and the glans clitoris. ये याद रखना. The deep inguinal lymph node drains the glans penis and the glans clitoris. Okay. The external genitals, the entire external genitals drains into which lymph node? Superficial inguinal lymph nodes. The external genitals, they drain into the superficial inguinal lymph nodes except glans penis, glans clitoris. This drains into the deep inguinal lymph node. Perfect. Is this clear? Okay. Deep inguinal, deep inguinal. Superficial inguinal will drain the rest of the things. Superficial inguinal का upper medial group होता है. You know the superficial inguinal lymph nodes is in the form of a T. I'm not going to details of this. This is upper medial, this is upper lateral, and this is the vertical group. Upper medial, upper lateral, and vertical. Just tell me what is the upper medial group drain. I'll just tell you this. Upper medial group. You get plenty of MCQs on this also. Upper medial group, it drains one, the anterior abdominal wall below the umbilicus. ठीक है ना? Upper medial group drains the anterior abdominal wall below the umbilicus. Second, it drains the perineum and the external genitals except the glans penis and the glans clitoris. That drains into deep inguinal lymph nodes. It drains the penile part of male urethra. Penile part of male urethra. It drains the anal canal below the dentate line. Very important, students, very important. Anal canal below the dentate line is drained into superficial inguinal lymph nodes. It drains the vagina below the hymen. Vagina below the hymen. And it drains the cornu of the uterus. Cornu of the uterus. Just remember this much. Itna yaad rakhiye. Okay. The superficial inguinal lymph nodes, upper medial group. Upper medial group. Once again, first. Anterior abdominal wall below the umbilicus. Second, the perineum including the external genitals except the glans penis and the glans clitoris. Penile part of the male urethra. Anal canal below the dentate line. Vagina below the hymen and the cornu of the uterus. Cornu of the uterus. Okay, that's it. Perfect, students. Perfect. Come on. Answer this. Diaphragm is a muscular structure separating the thoracic and the abdominal cavities. One of the following structures does not pass through the aortic hiatus of the diaphragm. So what passes through the aortic opening of the diaphragm? Which does not pass? Answer this. Up answer karo, then I'll tell you. Yes, very good. The hemiazygous vein. Hemiazygous vein does not pass. So what passes through the aortic opening of the diaphragm? One is the aorta, second is the azygous vein, and third is the thoracic duct. Aorta, azygous vein and thoracic duct. They pass through the aortic opening of the diaphragm. What is the vertebral level? Vertebral level. Aortic opening of diaphragm lies at what vertebral level? Answer this, students. Aortic opening of the diaphragm lies at T12 vertebral level. T12. What passes to it is the aorta, the azygous vein and the thoracic duct. What passes at T8 level? T8, yes, is the IVC and the right phrenic nerve. IVC and the right phrenic nerve passes at T8, IVC and right phrenic nerve. T10, what passes is the esophagus with the right and left vagus. Correct? Esophagus with the right and left vagus passes to the T10 level. T10. Bas ye yaad rakhna. Can you tell me, students, these are very high yield MCQs for you. Tell me this hemiazygous vein, how is it formed? How is the hemiazygous vein formed? By the joining of which veins is the hemiazygous vein formed? Can anyone answer this? Which veins joins to form the hemiazygous vein? Which veins? The left posterior intercostal veins 9, 10, 11 and 12. 9, 10, 11 and 12. They join to form what? The hemiazygous vein. This is hemiazygous vein. The posterior intercostal veins, the left posterior intercostal veins 9, 10, 11, 12. They join to form the hemiazygous vein. And 5, 6, 7, 8 joins to form what? What is this vein? 5, 6, 7, 8 joins to form accessory hemiazygous. Okay. क्या हुआ? Rajnish, what happened? हाँ, अच्छा, you're telling me options. Okay, fine. So 5, 6, 7, 8 left posterior intercostal veins joins to form the accessory hemiazygous vein. 9, 10, 11, 12 joins to form the hemiazygous vein. ठीक है? And tell me this accessory hemiazygous and hemiazygous joins whom? Drains into what? Accessory hemiazygous and hemiazygous drains into what? ये पता है ना आपको students? This you must be knowing, no? Or should I draw this? एक minute, just quickly tell me. Quickly, I'll draw this for you. This is internal jugular, that's a subclavian, that's a right brachiocephalic. Internal jugular, subclavian, that's a left brachiocephalic. The left joins with the right and forms what? SBC. And what is this vein? This is the azygous vein. Azygous vein. Correct? So now you tell me what is this vein? This is the first right posterior intercostal vein. Drains into the right brachiocephalic. First left posterior intercostal vein drains into left brachiocephalic. Second, third and fourth on the right side, they joins to form a vein here. इसका नाम है right superior intercostal vein. And the right superior intercostal vein drains into azygous vein. Second, third and fourth on the left side joins to form a vein. The name left superior intercostal vein, and this left superior intercostal vein drains into the left brachiocephalic. Now all the veins on the right side, they drain into what? Azygous vein. अब जितने भी veins है right side पे, they drain into azygous vein. On this side 5, 6, 7, 8. अब clear है? 5, 6, 7, 8 on the left side joins to form a vein here. इसका नाम है accessory hemiazygous vein. 9, 10, 11 and 12, they join to form a vein here, and this is the hemiazygous vein. Hemiazygous. And both the accessory hemiazygous and hemiazygous, they drain into what? Azygous vein. They drain into azygous vein. Is this clear to all of you? Now, what is accessory hemiazygous? What is hemiazygous? I hope this is clear. Fine, students. These are very important things. ये सब याद रखना. Okay. Okay, students. So now coming to the next MCQ. Answer this. Yes. A student developed tingling and numbness in the hand. On examination, the physician diagnosed it as compression of a structure passing deep to the flexor retinaculum. Which of the following structures pass deep to the flexor retinaculum? Answer this. Which of the following structure pass deep to the flexor retinaculum? Anyone? Nahi bacha. Not Allah, no. Which of the following structures pass deep? The answer is medial nerve. The medial nerve goes deep to the flexor retinaculum. No, and the medial nerve gets compressed below the flexor retinaculum, and this is what we call as the carpal tunnel syndrome. Carpal tunnel syndrome. Palmaris longus goes above the flexor retinaculum. ये flexor retinaculum के ऊपर से जाता है. And the ulnar nerve and ulnar artery, they pass through what? Can anyone answer this? The ulnar nerve and ulnar artery pass through the Guyon's tunnel. The ulnar nerve and ulnar artery passes through the Guyon's tunnel. The Guyon's tunnel. I'm so sorry. The ulnar nerve and artery passes through the Guyon's tunnel. Is this clear? Ulnar nerve and ulnar artery. It passes through the Guyon's tunnel. The palmaris longus goes above the flexor retinaculum. Above the flexor retinaculum. Very good. The median nerve goes below the flexor retinaculum through the carpal tunnel. और कोई जाता है? Anyone else passing through the carpal tunnel? Students, can you quickly tell me? Otherwise, I'll have to draw the slide for you. Tell me. Anything else which passes through the carpal tunnel? Students, बोलिए. Look. Quickly, I'll draw this for you. Quickly. ऐसा ना, you should be able to revise like this. Okay. This is the flexor retinaculum here. And this is the carpal tunnel. ये carpal tunnel बन गया. Now what are the structures which are passing through the carpal tunnel? What are the structures passing through the carpal tunnel? Can you tell me what is this structure? This is the tendon of flexor carpi radialis. What is this tendon of? ये है tendon of flexor pollicis longus. Flexor pollicis longus. Yes. What are these four tendons of? Flexor digitorum superficialis. What are these four tendons of? Flexor digitorum profundus. Flexor digitorum superficialis and profundus. And you know what is this bursa? ऐसे एक bursa होता है which encloses this superficialis and profundus. What is that bursa known as? Ulnar bursa. Ulnar bursa. And what is this bursa? Bursa is a synovial sheath which encloses the tendon. What is this bursa known as? Radial bursa. ये भी याद रखना. This is a very important MCQ. So the radial bursa encloses which tendon, students? The radial bursa encloses the tendon of flexor pollicis longus. The ulnar bursa encloses the tendon of flexor digitorum superficialis and profundus. ठीक है? Ulnar bursa encloses the tendon of flexor digitorum superficialis and profundus. And what is this structure that I have drawn? Anyone? Can you answer this? What is this yellow structure that I have drawn? This is the median nerve. That's the median nerve. Okay. See, bursa क्या होता है? Bursa is a bag which is filled with synovial fluid. वो friction prevent करता है. It prevents friction. When we move the wrist, friction होगा ना. So to prevent the friction, there is a bursa. Once again, I'm telling you, the bursa which encloses the tendon of flexor pollicis longus is. Be very clear. These are very high-yield MCQs. The bursa which encloses the tendon of flexor pollicis longus is radial bursa. Radial bursa. And the bursa which encloses the tendon of flexor digitorum superficialis and profundus, वो bursa का नाम ulnar bursa. That's ulnar bursa. And what is this? That's the median nerve. So the median nerve lies between what and what? The median nerve lies between the flexor retinaculum and the ulnar bursa, and this median nerve gets compressed here, and this is what we call as the carpal tunnel syndrome. Carpal tunnel syndrome. What is this retinaculum here? I mean, what is this extension here? This is known as the volar carpal ligament. Volar carpal ligament होता है ये. And what is this tunnel known as? This is what we call as the Guyon's tunnel. Guyon's tunnel. ठीक है? Yes. And what passes through the Guyon's tunnel, students? Through the Guyon's tunnel passes the ulnar nerve and ulnar artery. Ulnar nerve and ulnar artery. And what is this tendon who goes above the flexor retinaculum? That's the tendon of palmaris longus. That's the tendon of palmaris longus. Perfect. Perfect to all of you. Yes. This should be very clear. ये सब बहुत high topics हैं, golden points हैं. You keep this in your mind. Okay. I'll come to the last MCQ. Before coming to the last MCQ, students, let me just quickly brief you about our platform. एक last MCQ बाकी है. So we have got this plus subscription in which there is access to both live and recorded classes, study from the device of your choice, learning from the top educators, live quizzes, and you can access to our question bank also. An iconic subscription where you get the best of Unacademy and pre-platter. Some special class features like interactive live class. There is poll for the learners, raise a hand technique, never miss a class with proper notifications being given to you. Lecture notes, if you miss the class, you can get the notes, you can get the recorded sessions, and anytime, anywhere you can access the class and get your doubts solved. A highly updated and effective question bank has been prepared with detailed explanatory answers for you. And these are our NEET PG toppers in the last exams who have scored very good marks. So next time you would be scoring good marks in the FMGE exams and your names would also be there. Raise a hand technique in which if you press the icon, you can directly talk to the educator. And students, this free test, please do give. This is the last days before your exams. A final touch for the FMG students, the grand test. This is already done yesterday on Wednesday. Educated curated test series. Subject-wise test series, Wednesday 9 p.m. Study with me on YouTube, Friday 9 p.m. Special marathon class test series Sunday 9 p.m. and grand test series Sunday 9 a.m. Also we have got this plus class plus batch ritual tests. Okay. We're starting with 2 new batches integrated next system wise batch 2023. We have already started from yesterday and we've already started with this test and discussion batch 2022 NEET PG. Okay. Boost your medical preparation with 24 months you get 4 months free, with 12 months you get 2 months free, and with 6 months you get 1 month free. With 6 months you get 1 month free. Yes. Download the Unacademy app and subscribe to it. Okay, just the last MCQ. Answer this. Answer this. Answer this. Which of the following muscle covers both elbow and shoulder joint? Yes. Which of the following muscle covers both the elbow and shoulder joint? A last MCQ. Yes. Rajneesh. Bolo, bolo, bolo. All of you answer. I'm looking at the screen. B likha na. Yes. For the next it is like that. For the next. Yes, Vasim. No, answer is not coracobrachialis. Answer is short head of biceps. Answer is short head of biceps, student. Short head of biceps. Short head of biceps. Tell me, what is the origin of short head of biceps? That means see, अगर उसको elbow and shoulder joint पे add करना है, if it has to cover the elbow and shoulder joint, that means it should arise from the scapula. It should arise from the scapula. Then it would cover the shoulder joint and it should be inserted on the radius or ulna. Then it would cover the elbow joint. समझ में आ रहा है? So it should start from where? From the scapula. It should cover the elbow joint. It should cover the shoulder joint. It should get inserted on the bones of the forearm. It should get inserted on the bones of the forearm. Clear to all of you? So that is short head of biceps. Can anyone tell me what is the origin of short head of biceps? Chalo, answer this. Be fast. Origin of short head of biceps. Anyone? Next के लिए we give all clinical oriented MCQs only. Wasim. Short head of biceps arises from where? From the coracoid process. Students, the short head arises from the coracoid process. The long head of biceps arises from the scapula, supraglenoid tubercle of scapula. Supraglenoid tubercle of scapula. Okay, I'll just make this for you. Look at this quickly. Look at this. ये है, and that's the humerus here, and that's the scapula which you have drawn. Tell me which is this muscle, students. If you can answer this, which is this muscle which begins from the humerus? Which is this muscle which begins from the humerus and gets inserted on the ulna? बोल सकते हो ये ulna and this is the radius. Which is this muscle which begins from the humerus and gets inserted on the ulna? Bolo, 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 students. This is the brachialis. That's a brachialis. So brachialis is crossing only one joint. Which joint? It's crossing the elbow joint. So brachialis is going to act only on elbow joint. Elbow joint. Okay. Now, which is this muscle? If you can tell me, ये है ना? It begins from the coracoid process and it gets inserted on the humerus. ये कौन है? What is this muscle? That's the coracobrachialis. Coracobrachialis begins from the coracoid process, inserts on the humerus. Now this muscle will act only on shoulder joint. This muscle is going to act only on the shoulder joint. Only on shoulder joint. This will act only on elbow joint. Fine. And the triceps का origin क्या है? I'll just draw this for you. This is the posterior aspect. What is this head of triceps? This is the lateral head of triceps. And what is this head of triceps? Anyone? Below the spiral groove, this is the medial head of triceps. The lateral and the medial head of triceps, they begin from the humerus and they are inserted on the ulna. Ulna पे insert होता है ना ये, they are inserted on the olecranon process of ulna. This is the olecranon process. So the medial and the lateral head of triceps, they will cross only the elbow joint. They will cross only the elbow joint. You understanding? मतलब ये तीनों muscles are crossing only one joint. But if you see the biceps, the short head of biceps, where does it arise from? It arises from the coracoid process. The short head of biceps arises from the coracoid process. The long head arises from the supraglenoid tubercle. Both these muscles joins to form the belly of the biceps. We have taken it outside. इसे बाहर निकालते हैं, and this is inserted on the radius. Understand? So biceps is going to cross two joints. It will cross the shoulder joint. It will cross the elbow joint. Long head of biceps arises from above the glenoid cavity. That's the supraglenoid tubercle of scapula. The short head of biceps arises from the coracoid process, and both the heads joins to form the belly of the biceps, inserted on the radial tuberosity. Clear now? So which muscle is going to act on both the joints? The biceps. वैसे अगर long head of triceps भी option में है ना, long head of triceps begins from where? Can anyone tell me where does the long head of triceps begin from? Students, answer. Long head of triceps begins from here. What is this? the infraglenoid tubercle of scapula. Infraglenoid tubercle of scapula. So long head of triceps also acts on two joints. Which two joints? The elbow joint and the shoulder joint. Long head of triceps. Yes, long head of triceps is from the infraglenoid tubercle. Barabar hai na? Long head of triceps is from the infraglenoid tubercle. So it will act on both the joints, elbow as well as shoulder joint. Ritvik, clear? But ऑप्शन में ट्राइसेप्स नहीं था ना, ऑप्शन में मीडियल हेड ऑफ ट्राइसेप्स था, ऑप्शन में मीडियल हेड ऑफ ट्राइसेप्स था. सो दैट इज व्हाई वी हैव चोजन दैट एज द आंसर. लुक एट दिस. सो आंसर वुड बी शॉर्ट हेड ऑफ बाइसेप्स. Clear to all of you? This MCQ once again, have a look. So students, I'll take one more lecture for you on Saturday, nearly the same time. Okay. So a final brushing, a last minute revision before. This is just a quick revision for the FMG students. The exam is on 12th and we wish you all the best for all of you. अगर कुछ भी doubt है, anything which is not clear, anything which you want to understand, if it is, you can always tell me. Okay, so then we can discuss that topic. Okay. Clear? So thank you to all of you. Thank you. Thank you.